Right.
Hello, everyone. Thanks for joining us today. We are excited to kick off our virtual town hall series, one of two today. So we'll be back next week as well. And really just want to spend some time educating our members, our advocates, on the importance of vaccination knowledge and understanding. More than anything else, we have some dynamic speakers lined up today that we're excited to share with you all. And we look forward to hearing your questions that you may have and sharing all of the wisdom and information and knowledge that our speakers have. Thank you to Pfizer for sponsoring this dynamic opportunity to educate and, as I've continued to say, to share wisdom and knowledge on vaccines.
Thanks so much, Ebony. Hi, everyone. My name is Crystal McCauley. I know most of you, but if I don't know you, it's so wonderful to have you here on the call with us today. We'd like everyone to take the opportunity to jump into the chat and say hello. Let us know your name, where you are, and are you a Mom Congress member or are you visiting with us today? The town halls are an opportunity for Mom Congress to bring our community together, but also to showcase to others some of the things we do outside of just day-to-day advocacy. So as Ebony said, we're here today to come together as a community and receive some education on vaccines so we can deepen our understanding and knowledge. And if you are not yet a member, I'm going to drop a discount code in the chat. We would love to have you join us. We do have an annual membership fee that we've discounted down to just $5 today. We would love to have you join us over the next couple of months to see the really fun things that Mom Congress has going before we come back together for our in-person event in Washington, D.C. So I'm going to have a quick peek at our chat and see who all is here with us today. I see California, Maryland, DMV, Wisconsin, Texas, Los Angeles, South Carolina, New Hampshire. Hi, Heather. Wonderful. Indiana, Chico. Hi, Tracy. I'm not too far from you. I'm up in Northern California too. So wonderful to have you all on the call today. Keep saying hi, letting us know that you're here. And I know people will keep trickling in from the waiting room as we continue to talk. We'll say this again, but we will be recording our town hall today. So if members aren't able to see it live, we will share the recording on our members only webpage, and we will also be publishing this to our YouTube channel as well. So thank you for being here. Here's our agenda for today. Ebony, would you like to review the agenda and then I'll jump?
Sure will.
Thank you.
Yes. So we're going to kick off with some amazing member spotlights. Then we'll go into individual speaker presentations, and then we'll go into our guided panel discussion, allowing some room and space for some questions and answers afterwards. And then we'll close up and share about our upcoming events.
Fantastic. Hi, Zay from Alabama. It's so good to
Hi, Zay.
Ebony's here. Hey, Ebony from Philadelphia. Nice to see you too. So I would like to invite my friends and Mom Congress members and amazing advocates to turn their cameras on. We have both Felicia and Chandra here with us. I'm going to go ahead and spotlight you and just say again, thank you so much for being here. It's always great to see you both. We've been joking before the call that we all had the pleasure of seeing each other this weekend too, which what a great and rare treat. So I see Felicia. I'm looking for Chandra. Let's see, where did you go? There you are. Sorry, the screen sharing plus camera sharing, spotlighting at the same time. So technology. Well, thank you both for being here today. I'm going to read you all some bios for our wonderful Mom Congress members before we start our member spotlight. So Chandra Lewis brings a unique lived experience to her community advocacy and birth work. She's the mother of a stillborn daughter, Adonaiah Janae, and triple negative breast cancer survivor and wife. Chandra also serves as the executive director of a community doula-based agency and training program, and she believes that no one should ever be alone and that every birthing person deserves dignity of care, respect for their choices, and reproductive justice. Thank you so much for being here today. And Felicia Turner Walton brings a special lived experience to her community and birth work. Felicia is the mother of 6 children and 2 of her children who are not Earthside, one whom she lost to miscarriage, and her precious rainbow baby, Zaire, who passed at 4 months in 2016. She is also a wife. Felicia serves as doula network coordinator of a community-based doula agency, and she believes that no one should ever be uninformed about their body or their birth, and that every birthing person deserves to be heard, acknowledged, and supported. Thank you both for being here. Thank you for your amazing continued advocacy that you both bring to us continually. So great to see you all doing the work. And again, thanks for your time and being here. Spotlight, there you are. So wonderful. Well, we just want to take the opportunity to, highlight those that are doing the work, and it's the 2 of you. And you bring a unique perspective, and you are both joining us from Wisconsin. So just want to ask you both, what is it like to come to Mom Congress in DC as a team? Did you travel in together? Do you meet up when you're in town? Did you know each other before? How did you come to be the great unit that you are for coming from Wisconsin each year?
Felicia, would you like to start?
Sure, I can.
Okay.
So Chandra and I met a little over a year and a half ago, doing the work, her in a different space than me. Generally and because of our losses, naturally, when you meet another lost mom, the connection is just automatically there to understand, right? But generally we fly in separately. I have a love for American and Chandra has a love for Delta. But we have actually shared rooms each time. So we're basically together like we're twins at that point once we get there.
And it's been phenomenal traveling with someone from the same place that you are, because it can be a little intimidating. You're going to this whole new place, this whole new space. Do I know anyone? Can I connect? But then being able to branch out and go, hey, have you heard of my partner that's also doing this great work?
That's so fantastic. And it seems you guys have created a really great friendship too in your work together. So that's fantastic. I want to ask you both, you're both certified patient family partners through the Mama's Voices program. And Mama's Voices is a great partner to Mom Congress. Those of you that are members will know that all of our members have access to their patient family partner training, which is an opportunity to be trained virtually on sharing and crafting your story to bring it forward for your advocacy efforts. And I know you both do a lot of advocacy in a lot of different ways, not just legislative advocacy. So Chandra, if you'd like to start and give us kind of an idea of what it was like to go through the training and how it's helped shape who you are as an advocate.
So for me, I know there's a price point on this Mama's Voices patient family partner training, but there is no price for it. It's priceless. I could not tell my story without crying before going through this training. And going through this storytelling training and learning how to craft an anchor story, to nail down the salient points, to be able to be concise and still get my point across is invaluable in these legislative meetings, because you only get 10, 15 minutes to tell down your story, to nail down your story, to get that across, and why you're advocating for what you're advocating for. So I would not be the person that I am and the champion that I am without going through Mama's Voices training.
We need that on video, like bottle that up. What an amazing selling point. Thank you so much. Felicia, your reflections as well?
So definitely everything that Chandra said, and I would only add that, in the beginning when you're going through the process, and for me, having had plenty of other storytelling trainings, I was like, here we are again, something new we gotta add, another storytelling training. But this training was so spot on. I literally completed it in one day. It gave a different insight of how to share your story. Like Chandra mentioned, the points to get your story across, but it also gave it your voice. And I think that's the piece for me that really captured. And like everybody, I tell them, reach out to Mama's Voices to get the code so you can take this training, because it's literally invaluable. And if I had to do it all over again, I think if I would have had Mama's Voices training in the beginning, that probably would have sealed the deal and been the only one I did.
That's awesome. So great to hear. I'm glad to hear that it kind of took what you already knew and made it, consolidate it down in a way that felt digestible and was really productive. So thank you so much for sharing that. Well, I look forward to seeing you both as soon as possible again. I know that I'll let everyone know we have not announced dates yet, but we are hoping to go back to DC in May. So right after Mother's Day, we're looking at going to DC May 14th and 15th. It's that Tuesday, Wednesday. So stay tuned to your email. We will be sure that you are the first to know when we get the hotel locked down and our rooms secure on the Capitol. I can't believe we're about to turn around and do it again, but we're going to do it again. It's going to be great. And again, thank you both for your time. Sending you both so much love. Thank you for all
Thank
you
you. The dynamic duo will definitely be there.
Can't wait. Can't wait.
Absolutely.
Fantastic. Okay, well, Ebony, I will prepare to turn it back over to you. And allow you to introduce our speakers for today.
Awesome. Well, I have the privilege and honor of introducing our speakers. I just want to say that the doulas are showing up today, Crystal. I see it in the chat. I just have to acknowledge that. So shout out to all of the doulas that I'm seeing in the chat today. But I have the privilege and honor of introducing two amazing, phenomenal speakers for today. And I'm going to read each of their bios before turning it over to them to share some research and findings in their respective fields. I'm going to start with Dr. Louis. Dr. Louis is a department chair for the Department of OBGYN at University of South Florida. She is a specialist in maternal fetal medicine and is a former president of the Society for Maternal Fetal Medicine. Dr. Louis has a joint faculty appointment in both the College of Public Health and the College of Medicine at USF. She serves as a member of the board of directors for March of Dimes and the Society of Women's Health Research. After completing a maternal fetal medicine fellowship at Wayne State University, Dr. Louis embarked on a career studying obstructive sleep apnea in pregnancy. At the time, little was known about the disease and its implications for maternal and infant health. She collaborated with sleep medicine experts and anesthesiologists to define the outcomes associated with sleep apnea in pregnancy. Her research portfolio has expanded to include research on maternal morbidity and mortality and consequences of sleep disorders. My apologies. She has authored more than 80 scientific articles and book chapters. NIH, Robert Wood Johnson Foundation, other private foundations and industry have funded her research. Dr. Louis has focused her most recent advocacy work in research and has been a champion of studying health and equity and inclusion of pregnant people in clinical trials. Before we move on, I'd like to introduce to you all as well, Katie. Katie is co-founder and board member of the Washington-based Get the Medications Right Institute. What a name, right? Get the Medications Right, because that's real. And founder and president of Health to Resources, a national healthcare project management and consulting firm practicing in the Washington area for nearly 23 years. At GTMRX, Katie collaborates with fellow board members to develop and execute the Institute's strategy, bringing together critical stakeholders to focus on appropriate use of medications and gene therapies. Launched in 2019, the organization has grown to more than 1,800 members from over 1,100 organizations in 49 states. Members are bound together by the urgent need to optimize outcomes and reduce total cost of care by getting the medications right. A gifted communicator, manager, and coalition builder, she cultivates relationships with stakeholders across the healthcare and health policy spectrum. Katie has a long history of collaboration in multi-stakeholder environments. As Health to Resources founder and president, she and her team have helped clients meet advocacy, policy, outreach, awareness, and business goals since 1998. In that capacity, she was instrumental in the launch of the key advocacy organizations, including Patient-Centered Primary Care Collaborative, now PCC, and the eHealth Initiative. Prior to establishing Health to Resources, Katie served as president of the Alabama Healthcare Council, a CEO-governed business coalition focused on healthcare costs, quality, and affordability. It used advocacy, measurement, and group contracting to decrease costs and increase quality of care, access, and accountability. She successfully negotiated a multi-year, statewide, value-based purchasing contract with the state's largest health plan. There's so much more to share about Katie, and we're going to drop both of their bios and share both of their bios with you all. But without further ado, I'd like to pass it over to Dr. Louis.
Thank you so much for having me. I am so excited to be a part of this effort, and particularly to speak about something that I am so passionate about. I was hoping we can get the slide up that shows the SMFM webpage. So, as stated, I am a prior president for the Society for Maternal Fetal Medicine. Particularly, I was president during the COVID pandemic. And at the time, a lot of the work that we did really highlighted the need for emphasis on patient education regarding vaccines, right? There was so much misinformation, and there still is a lot of misinformation out there. But yet, on the scientific side, we know the benefits. And so a lot of the work that we were doing was centered around getting the information out there and empowering patients with information. What we have on the screen is a web page that SMFM, we lovingly call it the Society for Maternal Fetal Medicine, put out so that it can really help guide patients and people who take care of pregnant patients, so that they understand what are the recommended vaccines during pregnancy, and give them some more information about each one of them. And in my world, I take care of moms who are pregnant, or patients who are pregnant. And so I have two patients, right? I have, the pregnant person themselves, but then also the fetus. And when you look at these vaccines, some of them are to benefit the person who's pregnant, and some of them are to benefit the fetus or the newborn baby. And so the four that are recommended during pregnancy are the influenza vaccine, the pertussis, COVID-19 vaccine, and RSV. And just to briefly touch on each one of them, we recommend the flu vaccine simply because there is long-standing data now, very clear data, that if you're pregnant and you catch the flu, you are more likely to end up critically ill, you're more likely to end up in the intensive care unit, and you are more likely to die. We saw the same thing with the COVID pandemic, and that data still, bears out today, even though you don't hear as much about COVID. And for a lot of people, the COVID infection is more like a cold, a very bad cold. We are still seeing that if you're pregnant, you are more likely to be the person to progress to a severe version, more likely to be hospitalized, and slightly higher risk of death. And so the best way to prevent those from happening is to prevent getting the infection up front. And the best way to prevent the infection would be to have the vaccine. Then the other two vaccines that help benefit really the infant and the neonate, whooping cough, or what we call pertussis, which is recommended to be taken during pregnancy, and then RSV. And the way those two work is that they boost up the mom's immune response that then is passed on to the baby. So then when the baby is exposed, that they are less likely to develop RSV or whooping cough. And, you know, both conditions are severe enough that they cause significant illness in quite a few neonates, but then of course the most concerning ones are the ones where it's severe enough that they are critically ill or God forbid pass away. And so from our perspective, we recommend these in pregnancy. Some of the questions that I often get from patients regarding what's the timing of when they should take those vaccines. And so typically we say in a pregnancy, you get your COVID and your flu vaccine as soon as possible. Typically the pertussis one around 27 weeks and the RSV one, ideally you'd get after 32 weeks. I'm sorry, ideally at 32 weeks. So that then after it, as your body builds the immune response, it gets passed on to the baby around the time of delivery. And so that's just a brief overview of the vaccines that we recommend. And you can go to this website. There's an English and a Spanish version, and we're hoping to have other languages soon. And you can click on the various tabs that give you even more information. Thank you.
Thank you so much, Dr. Louie, for that amazing overview. We are grateful for your knowledge and your expertise. We will go ahead, Ebony, I'll pass it back to you and I'll get my screen sharing sorted out.
Awesome. Thank you, thank you, thank you. As I shared at the beginning, we will leave some space and time for questions if you have them for Dr. Louie. We'll drop the link to this as well and share it in our follow-up communication, just so, like, knowledge is power, y'all. So just so that you have the information, you can choose what you would like to do with it, but just so that you have the knowledge and information. So we thank Dr. Louie for her wisdom and sharing her expertise. I am going to pass it to Katie now to share more about her findings. Awesome. Right on time, Crystal.
Thank you so much. And thank you for this opportunity. It's a pleasure to present with Dr. Louie and also those that have had personal experiences. And thank you so much to Moms Congress for the opportunity. As mentioned, the Get the Medications Right Institute is a national coalition of over 1,700 members. We had the pleasure of working with the Bipartisan Policy Center, who I think is a partner with Moms Congress as well. And the Bipartisan Policy Center, for those of you that might not know, we're using a rare word in Washington these days. It's bipartisan and by nature. The Get the Medications Right Institute believes that appropriate use of medications is a bipartisan issue and should be a bipartisan issue. And during the pandemic in April of 2021, we convened in partnership with the Bipartisan Policy Center a national task force that would work for 90 days to create a set of recommendations to build vaccine confidence. Now, we started our journey thinking that we were building vaccine confidence in the medical neighborhood and quickly realized that we were very wrong in that. We were building vaccine confidence in the health neighborhood. So during that 90-day period of time, we significantly reworked our name, and the final report basically is called Building Vaccine Confidence, the Role of the Health Neighborhood. A task force was announced in April of 2021. We had our kickoff through C-SPAN with the Bipartisan Policy Center. Very important task force members or co-leaders, Dr. Georges Benjamin, the Executive Director of the American Public Health Association, and Dr. Paul Abramowitz from the American Society of Health System Pharmacists co-led that task force, along with Susan Denzer, who at that time was Senior Policy Fellow at the Robert Margolis Center for Health Policy at Duke University. And Susan is now the CEO of the America's Physicians Group. And I, as the executive director at that time and co-founder of the Get the Medications Right Institute, was the staff officer on this initiative. The task force was comprised of a multi-stakeholder group across the country: academia, professional organizations like AAFP, ACP, American Nursing Association, National Partnership for Women and Families, who I think is also a partner with Moms Congress, Bipartisan Policy Center, the VA, employer groups, the FDA, a variety of important folks as we look at coming to consensus on an approach to building vaccine confidence in communities, consumer groups, physician groups, provider groups, and the like. Next slide, please. What we did was we, over that 90-day period from April to June of 2021, came up with a set of final recommendations through the task force. It was a 90-day period of time. This task force met every other week for 90 days. And for those of you that remember the time frame of the pandemic, I think the first vaccines rolled out in December of 2020, and they were rolling out in the first quarter at different phases and different states throughout the country. But what we were finding, and certainly through the literature research that we did, there were two reports that we created. We created a report in April of 2021 that basically was a literature search, why we experience vaccine hesitancy and why it's important to build vaccine confidence. Again, that's a deliberate choice of words in terms of hesitancy and confidence, because what we found was building confidence requires trust, and it requires trusted sources. So in the final report that we brought forward in June of 2021, after the kickoff on C-SPAN through the Bipartisan Policy Center, we made short-term recommendations to boost COVID-19 vaccine confidence, and then long-term recommendations. But I'd like to point out that the recommendations that we made surrounding the COVID-19 vaccine are very similar to recommendations that would be made to build vaccine confidence in general. And I'll go through some of those recommendations with you, but I would encourage you to look at the chat function to access this report yourself. We had some key considerations as we went into this. We recognized that it was important to spare ongoing suffering and death amid the COVID-19 pandemic. So it was essential to and crucial to get as many people vaccinated in the United States and worldwide as possible. But given the history of vaccine hesitancy in general, we had to overcome that and build confidence and identify ways in which we could do that very quickly. We believe that communities across the U.S. should bring together a broad group of stakeholders across the local health neighborhood, and I'll define that for you in a moment. I think this is essential to bring those stakeholders together. What we found early on in the pandemic is there was money coming from the federal government, but it was going along the lines of professional organizations like the pharmacists and the physicians and those lines. There was very little money going to the local communities to really work together to build confidence at the community level. Part of it had to do with the fact that they weren't organized. Part of it had to do with the fact that we were all caught off guard with this. But we found we had several key considerations as we went into this. Another key consideration was the importance of strengthening the immunization information systems and the public health infrastructure, because of course we've eviscerated the public health system over many years of privatizing the healthcare system in general. So the health information systems that should support a pandemic that would allow for bilateral communications, and by that we mean communications between a primary care physician and the public health department about who has and hasn't been immunized, the communication between the physician and their patients about the importance of this, targeted communications. We were not really prepared as a nation to deal with that or to manage that in the way that was necessary. And then creating parity of vaccine supply to all vaccination sites, rural communities, metropolitan areas that are hard to reach. The underserved communities. So those were some of our key considerations in going into this. We defined within the context of our report what we meant by the health neighborhood, and there's a broader definition in this report, but I think it's important as Moms Congress and others move forward to look at some of these definitions as a way of being prepared when these things occur again, because they will occur again. And as we move forward, recognizing that the traditional medical system was left wanting, both from a public health standpoint and from an information standpoint. So in defining the health neighborhood, it was the traditional hospital and health systems, primary care physicians, and other clinicians and providers, nurse practitioners, RNs, clinical pharmacists, and other key team members, community health centers, federally qualified healthcare centers, clinical pharmacists, health insurers, employers and local businesses, local health or public health departments, other branches of local government, social service agencies and providers, military and veteran organizations, schools, school boards, PTAs and municipalities, higher education institutions, and important community connectors. And with the important community connectors, we're talking about hairdressers, barbers, bus drivers, people in the community that are trusted sources that can have an impact in those local communities. So it was important that we brought forward a definition of the health neighborhood. Next slide, please. We also recognized, in order for us to have an impact immediately, the task force had a real bias toward creating collective impact. And in order to create collective impact in that health neighborhood, and remember, we moved consciously from the original assumption of the use of the term medical neighborhood to go into the health neighborhood. We used the collective impact model that assumes that members will rise above their individual agendas and reach beyond their professional silos and build collective approaches to complex problems. Now, as I mentioned, it didn't help any that the federal money went out through the professional organizations. So the streams of money that were flowing to communities were flowing through those silos as opposed to the local communities. So there's a lot of information in the report around the importance of building backbone organizations and also looking at this through the lens of through a racial justice lens, diversity of people and perspectives, inclusiveness, power, voice, organizational culture. Equity equals results from policy, practice, and position. So it's a diverse group by nature, a multi-stakeholder group by nature, but it's built on values within that community, recognizing that there are trusted sources in the community that you must tap into in order to create trust. Next slide, please. We made a set of long-term recommendations. We certainly don't have time to go through all of those long-term recommendations, but I would encourage you to read these reports. They're free. The Get the Medication Institute is, all of our materials on our website are free. You are also can become a member of the Institute free, but I'll just quickly go through some of the long-term recommendations, particularly as you guys organize at the community, regional, state, and federal level. Vaccine confidence leagues are important structures within local communities to build confidence within those communities. Rapid movement through the EUA process or the emergency use authorization in order to build trust among citizens and local communities and the medical community that there has been rigorous science behind evaluation of use of those vaccines. Community information system connectivity. I cannot understate this enough. We were very disappointed that the CDC, for instance, had a conceptual structure established, but they didn't have the authority to establish activities for bidirectional communications between primary care physicians or other medical providers and the populations that they serve. Next slide, please. Low and no cost access to vaccines, payment for vaccine administration. Again, it's important as we look at vaccine administration among a number of diverse settings and broadened settings that there is a reimbursement for the administration of those vaccines. Vaccine administration sites broaden so we can reach people in hard to reach places, the homeless, those in rural communities, those in metropolitan areas that quite frankly don't have transportation to some of the traditional sites in order to receive a vaccine. And then finally, some of the long-term recommendations around childhood policy proposals to ensure long-term accessibility and affordability. I'd love to talk to you more about this, but time does not allow, but hopefully I've piqued your interest enough that you'll download this report and go through it. There's a nice bibliography as part of it and citations for organizations that will offer additional information. But in summary, I think there are 4 key things as we look at approaching other pandemics in the future, or building vaccine confidence in general, engaging care teams in the local community, coordinating with schools, religious organizations, and employers, collaborating with local, state, and federal agencies, communicating across the community to ensure effective, efficient, and engaged community response. Bus drivers, hairdressers, barbers, and the usual suspects. This is not just a medical response. This is a community response. At the Institute, we believe that trust plus time equals impact. It takes time to build trust, and it takes time to identify those individuals within communities that are trusted voices. Thank you for the opportunity. I look forward to your questions. We have our website listed here, and you will find in the chat section how you can access both the lit review and the final report.
Awesome. Thank you so much, Katie. That was extremely valuable information. I love the aspect and component of trust. I love that. So thank you for sharing. All right. So, Shamika, I see your question, and I think we're going to answer it in a few. Nice to see you as well. So we're going to go ahead and dive into a guided panel discussion with a few questions. And like I said, at the end, we'll give you all about the last 5 to 10 minutes time. If you have questions, I'll filter through the chat box and kind of direct questions at our panelists for today. So the first question that I have for Katie and Dr. Louie is, Mom Congress has an annual package of supported legislation known as our Mom's Agenda. Each piece of legislation is bipartisan in introduction. It aligns to our policy priorities, which are maternal health, maternal mental health, working families, which includes paid family leave and childcare, all with the focus on equity. So from your perspective and your experiences and all of the knowledge and wisdom that you shared today, how does vaccine education and awareness impact these policy priorities, such as maternal health, maternal mental health, and working families?
I can start answering that. First of all, I want to applaud you for making this a bipartisan issue. I think part of the issue in building vaccine confidence in the medical neighborhood and the health neighborhood is the polarization from a political standpoint that really got in the way of some important, serious discussions around building trust and building confidence. So kudos to you and your organization for recognizing that these issues are bipartisan, and the political rhetoric that enters into it becomes noise in situations oftentimes. In terms of vaccine confidence, and I'm not a clinician, so it will certainly be important to hear from my colleague and co-presenter about that. I will tell you that recognition and reliance upon the science and really a bipartisan perspective of that becomes essential and important as well.
Thank you. From my perspective, I think one of the most important goals is for us to say we want people to have the information to make decisions about their own health and the health of their children, because quite frankly, we know that if you don't have a healthy mother, that it disrupts the whole family unit. And so from the standpoint of policy priorities that help facilitate that, to me, they center around things related to making sure that people can have the information that they need to make those decisions. But then if they decide that they do want to use vaccinations as a tool to ensure their health, that they also have access to it. So that's where we get back into, making sure that that there's adequate funding, for all of these tools that they need, but then access to it, and that there are sufficient practices that are offering the vaccination, so that if a patient decides that they want it, they can have access to it and they have means to pay for it.
Yeah, and I'd like to add one other thing to my response too, is kind of playing off what you've just said. The Affordable Care Act mandates that all vaccines recommended by CDC's Advisory Committee on Immunization Practices be provided by all commercial health insurers. So payment is an important part of this, payment for the vaccine in general. But also, and I mentioned this as part of the long-term recommendations very quickly, but payment for vaccine administration is also important. So you're talking about payment not only for the vaccine, but payment for administration of the vaccine. So it's affordability, it's access, and access is dual. One is, making sure that the medication is appropriately, is affordably priced, but also making sure that your access points, you are paying for the administration of that vaccine as well. And then in order to broaden access to vaccines for underserved communities, homeless, those in metropolitan areas that don't have transportation, or those in rural areas, it's also important to consider from a policy standpoint how you might broaden those access points through things like pharmacies, or through things like churches, or through things like schools. I mean, I may be older than many here, but I certainly remember the sugar cube with the polio vaccine on it in the schools. So, these things I think are important to blow up what we might think of as the traditional medical model and see it as a community, neighborhood model. I think that becomes important too as you look at your policy solutions with this. So it's access, affordability, and thinking creatively and outside the box a bit from what we think of as the traditional medical model into more of a definition of health, which is mental, physical, and social well-being that is across the community.
Thank you. It seems like most things boil down to access and affordability. And I really love the emphasis on the health of the community. So thank you, thank you, thank you. One more question before we dive into Q&A. I'm a lifelong educator at heart, everyone pretty sure they know, but I'm a proponent on making sure everyone knows that you have a voice and you have a right to ask questions. So from you all's perspective, what questions should one ask or consider if they're concerned about vaccinations? Because it's real, there's different reasons why someone may be concerned, and they may have questions, but what questions should we be asking?
I think they should. Okay, go ahead.
No, I was going to defer to the medical specialists there in that regard. So.
Yeah.
Please.
So, I think in healthcare, one of the areas that where healthcare has not done a good job is to empower the patient to ask their questions, and recognizing that each person is individual, right? And I think one of the most common questions that people have in the back of their minds, but then don't ask us, is they'll say, "Wow, that's a lot of vaccines that are recommended in pregnancy. Is it safe?" And you should ask that question. The fact is, for the vaccines, we have a lot of safety data, but then there's also sometimes the decision making about whether we recommend something is based on the alternative, that people who didn't have it and what happened to them. And so I think you should be empowered to ask that question if you're worried about safety, to get your specific questions answered. Sometimes the questions that people have are are really related to their specific scenario. So for instance, I've had some people ask me, okay, well, I'm worried about taking these two vaccines together because I read XYZ. And I welcome the opportunity to answer those questions. And so I think I really would love for people to feel empowered to ask those questions, and you should in return get a response that really looks at your particular situation and how it relates to your health, and how in that situation it helps to improve or protect the health of you and your fetus or baby.
Yeah, and what a terrific response. And I would just add to that, because the Get the Medications Right Institute is a group of consumer groups, providers, and employers, those who pay for care, provide care, and those who receive care. And we really believe an important tenet at the Institute is appropriate use of medications. And appropriateness is, how does it impact me? How does it impact me and the other medications I might be taking? And in what way, and what are the things that I should consider for me or my family? So I agree with you 100% and certainly at the Institute, we believe that consumers need to be empowered not only to ask those questions, but there to be respect for the questions that those individuals ask. I mean, no longer are we in the age where someone goes to a primary care practice and they're, the response is, what, you're one of those internet geeks and you read this on the internet and you want me to answer these things? I think physicians recognize, as indicated, that these are important questions to ask. You have a right to ask them, and you have a responsibility to ask them. We also believe at the Institute that the clinical pharmacist, in partnership with the primary care physician or specialist, not separate from, because we believe that you should collaborate with and not see as separate from the clinical pharmacist, is increasingly growing as a medication expert or specialist. And in partnership with that physician, it can work to help dispel some of the either myths or create reassurance in use of vaccines or other medications as well.
That was a phenomenal response from both of you. Thank you. Thank you. In our last couple of minutes, I just want to open up the floor. If anyone, please, we're going to use the chat box for now. Please filter your questions. If you have a question that you'd like to ask any of our presenters, please drop them in the chat and we will be looking for your questions. Okay, I do see a question, Dr. Louie and Katie. What about the studies that dispute that vaccines may cause harm? Are we offering all information to ensure informed consent?
I can't
So-
answer that. Oh, go ahead. Go ahead.
From my perspective, we do. So science is hard, right? It's hard from the perspective, and I speak as a researcher. So I've been conducting research ever since the year 2000. So we're 23 years in. There are so many bad studies out there. There are many good studies too. And so what we try to do is we try to take the well-designed studies, because there are so many instances where harm has been created by using the studies that were not well-designed, or studies that that had bias. Now, I think that's the challenge, is that there's so much out there, and trying to filter out what exists, what doesn't exist, and the studies and what they're finding. Because for any given thing, I don't care what it is, if you find one study that says it's beneficial, you'll often find another study that says that it isn't, and it's hard to figure out which one of those are credible. But the scientific world does have criteria by which you should be using to to look at how the study was conducted, and the likelihood that the answer is a true answer. And even then, it's nuanced. It's, what population did they use? What were the circumstances? And that there may be some details where, even though it may make sense for, the group that was studied, maybe it may not make sense for you individually. And that's where it gets back to the hey, you're an individual, you know, having a conversation with your obstetric care provider to say, okay, does this make sense for me? The other thing, and it's a whole premise of shared decision making, is, you know, before embarking upon it, you know, I ask the patient, like, what is important to you? Like, what are the things that, you know, that will impact you in your decision making? And sometimes patients say, well, they, you know, it's two, and it's funny to me because it's two sides of a certain way to look at things. Some will say to me they would feel worse if they, you know, took a medication and there was harm. Another patient may say to me, well, they would feel worse if there was a potential way to prevent this and they didn't do it, right? The answer in the end really is dependent on the individual and what's important to them. And I think that's what it goes back to. So yes, you present the data, but you also have to be cautious to not present, you know, data that clearly was poorly designed or was put out there by someone who has a bias and wanted a particular answer. And, you know, and on, you know, on that line, you know, I saw that this was, you mentioned in the beginning of this session, Pfizer. I'm not paid by Pfizer. I'm not paid by any vaccine makers. I'm a scientist. Takes care of patients who I have seen end up in the ICU from viral illnesses. I've seen even we've taken care of some who have died from viruses. And so that's where the passion comes from. And you may even argue there's a bias in that, right? That I can be so affected by seeing those maternal deaths that didn't have to be, that then I take a certain position. And so that's why we really have to put it back in the hands of the patients, but empower them with the right information.
Yeah, I agree 100%. And I think it's important to recognize that our whole medical system is going through quite a disruption and a change. And I think that if we go back to recognition that developing a healing relationship of trust between the primary care physician or the specialist that individual might have, and seeking counsel and advice from those individuals, recognizing that particularly when we're going so quickly through something like a pandemic where we're operating under emergency use authorization and there's not, you know, we sometimes get ahead of the evidence that comes out. But I do think that it is important to recognize as consumers our role in educating ourselves, crafting the appropriate questions, and identifying the subject matter experts or medical professionals that we trust and have a healing relationship of trust with. It's complicated, and when we went through the pandemic, it was wrapped in so much rhetoric from a political standpoint. It also made it quite difficult because we were confronting something that we had not. Now, as we move forward as a nation, certainly building those community resources and trusted voices within the community to help support efforts within the medical community, I think will become even more important and essential. But it does need to be supported by the science and as mentioned, those rigorous studies. You can find contradictory information on just about everything that goes out. Witness areas around dietary requirements. So.
Thank you. Thank you. Thank you. I've navigated this with myself, with my own daughter. She has a navigating something, and we had to be cautious with the vaccines that we were navigating. And that was just a conversation that me and her provider had. So thank you for sharing both from a very transparent standpoint. And thank you, Shamika, for asking this question as well. So thank you. Thank you. I think we may have time if there's one more question. Oh, okay, we have one more question. Good question. So the question is, has more work been done since the pandemic to ensure more diversity in the trial and research studies being conducted and those participating? And if so, any more information on those efforts?
I guess I can chime in on that one because that was a heavy part of what I did during the pandemic, was to meet with pharmaceutical companies. You know, just to sort of summarize what the issue is, You know, when you have these pandemics or new diseases or rare diseases, they will exclude certain groups of people from the trials. And then when there's a beneficial medication, they say, oh, we can't use it in those populations because they weren't studied. So it sort of, you know, sets you up to, you know, to further create inequities. And so we lobbied the pharmaceutical companies with varying degrees of success. And I say varying degrees of success where some pharmaceutical companies were very open and said, you know, you're right, we should include pregnant patients, but there's some challenges related to FDA and how we can do this. But there are other ways that we can release data. And so some of the pharmaceutical companies are working with Society for Women's Health Research in that perspective. But we still have very far to go. They really think that, you know, in some instances that they're helping by excluding certain groups, that they're protecting the groups, but COVID was a prime example of where they were not helping, because then when they found something that they thought worked, then you know, there was no data on pregnant patients. In terms of recruiting more diverse populations, you know, there is a lot of lip service to them understanding that they need to do it, and finding ways to engage the right people in the studies. And I do think it depends where you are as to whether truly how hard it is to recruit diverse populations into clinical trials. In places where you put in a robust effort, there may be some barriers, but they can be overcome. You know, but again, it has to be conducted in a way where the populations that you are trying to recruit have a seat at the table, so that they can provide input about the best way for recruitment, and also to protect those individuals who are part of the trial. So
Yeah,
the work is happening, is just too slow.
Yeah, I don't have anything to add to that, because I agree it is moving too slowly. There is a lot of lip service, and there's a lot of discussion around this, and you will see that there are a lot of organizations trying to create new divisions that will focus on that. But I don't know that we've seen enough quickly enough. So. And again, that may be a policy implication for you from a Moms Congress standpoint. Certainly, you know, that was the question asked at the beginning. You know, what should be, how could this impact some of your recommendations? We certainly know that through our report, we recommended that building the health neighborhood and the vaccine confidence leagues should be done through a racial justice lens, and absolutely clinical trials as well. To ensure that that you have a diverse population that those medications have been used with or tested on.
Thank you. Thank you for the question, Lori, and thank you both for again, just your transparency. I value the transparency of the answer. So thank you all so much. In the interest of time, we have 1 minute left. I agree, Lisa, as well. We do have to hold space for all perspectives and all parties involved. So thank you for that as well, Lisa. With 1 minute left, I will keep us going and wrap things up. Unless I missed something, Crystal.
No, you're all good.
I'll toss it to you for this one, Crystal.
Okay, sure. Absolutely. Yes. Thank you all so much. And thank you for offering your honest opinions and allowing a really robust conversation. It's one of the things that we think we do best around here at Mom Congress is listen and lift up all voices. So we appreciate everyone's time. I will put in a plug here that if you haven't already heard, if you are a Mom Congress member and you may have been patiently waiting to hear about this bill, part of our member survey last year included members bringing forth the fact that we were in the midst of a formula shortage and new recommendations that breastfeeding be extended up to 2 years. And so access to feeding and supportive and safe feeding is important to our members. And to that end, we are very excited to have added the Access to Donor Milk Act to the Moms agenda. We'll be training on this bill next Tuesday, November 14th at 2 p.m. It'll be one of our usual, 20-30-minute programs. We're excited to welcome the policy leadership from the U.S. Council on Breastfeeding to join us for that training. So if you are not yet a member and here with us today, I'll drop a link in the chat, and also that discount code for you to join us today, which is going to be Town Hall 23. I just dropped in there. I'll get a link for membership as well. And then there should be one more slide on here. I don't see it, but we are having our next town hall the same time next week. So you can come together, join us for another robust community discussion at the same time and place. And we look forward to welcoming you all then. Thank you again, Dr. Louie and Catherine. It was such a pleasure to have you both here, and we're grateful for your education and your leadership in this really important conversation.
Thank you so much. And
Thank
again,
you.
I would urge all of the listeners to stay informed, do what you're doing, stay the pathway forward, and recognize that you are your own and best advocate. So
Thank you.
Thank you, everyone.
Mm.